WHO Statement on Classification of Omicron, B.1.1.529, SARS-CoV-2 Variant of Concern. The Technical Advisory Group on SARS-CoV-2 Virus Evolution, TAGVE, is an independent group of experts that periodically monitors and evaluates the evolution of SARS-CoV-2 and assesses if specific mutations and combinations of mutations alter the behavior of the virus. The TAGVE was convened on the 26th of November 2021 to assess the SARS-CoV-2 variant, B.1.1.529. The B.1.1.529 variant was first reported to WHO from South Africa on the 24th of November 2021. The epidemiological situation in South Africa has been characterized by three distinct peaks in reported cases, the latest of which was predominantly the Delta variant. In recent weeks, infections have increased steeply, coinciding with the detection of B.1.1.529 variant. The first known confirmed B.1.1.529 infection was from a specimen collected on the 9th of November 2021. This variant has a large number of mutations, some of which are concerning. Preliminary evidence suggests an increased risk of reinfection with this variant, as compared to other VOCs. The number of cases of this variant appears to be increasing in almost all provinces in South Africa. Current SARS-CoV-2 PCR diagnostics continue to detect this variant. Several labs have indicated that for one widely used PCR test, one of the three target genes is not detected, called S-gene dropout or S-gene target failure, and this test can therefore be used as marker for this variant, pending sequencing confirmation. Using this approach, this variant has been detected at faster rates than previous surges in infection, suggesting that this variant may have a growth advantage. There are a number of studies underway and the TAGVE will continue to evaluate this variant. WHO will communicate new findings with member states and to the public as needed. Based on the evidence presented indicative of a detrimental change in COVID-19 epidemiology, the TAGVE has advised WHO that this variant should be designated as a VOC, and the WHO has designated B.1.1.529 as a VOC, named Omicron. As such, countries are asked to do the following. Enhance surveillance and sequencing efforts to better understand circulating SARS-CoV-2 variants. Submit complete genome sequences and associated metadata to a publicly available database, such as GISED. Report initial cases/clusters associated with VOC infection to WHO through the IHR mechanism. Where capacity exists and in coordination with the international community, perform field investigations and laboratory assessments to improve understanding of the potential impacts of the VOC on COVID-19 epidemiology, severity, effectiveness of public health and social measures, diagnostic methods, immune responses, antibody neutralization, or other relevant characteristics. Individuals are reminded to take measures to reduce their risk of COVID-19, including proven public health and social measures such as wearing well-fitting masks, hand hygiene, physical distancing, improving ventilation of indoor spaces, avoiding crowded spaces, and getting vaccinated. For reference, WHO has working definitions for SARS-CoV-2 variant of interest, VOI, and variant of concern, VOC. A SARS-CoV-2 VOI is a SARS-CoV-2 variant with genetic changes that are predicted or known to affect virus characteristics such as transmissibility, disease severity, immune escape, diagnostic or therapeutic escape, and that has been identified as causing significant community transmission or multiple COVID-19 clusters, in multiple countries with increasing relative prevalence alongside increasing number of cases over time, or other apparent epidemiological impacts to suggest an emerging risk to global public health. A SARS-CoV-2 VOC is a SARS-CoV-2 variant that meets the definition of a VOI, see above, and, through a comparative assessment, has been demonstrated to be associated with one or more of the following changes at a degree of global public health significance. increase in transmissibility or detrimental change in COVID-19 epidemiology, or increase in virulence or change in clinical disease presentation, or decrease in effectiveness of public health and social measures or available diagnostics, vaccines, therapeutics.
So today, WHO's Technical Advisory Group on Virus Evolution met to discuss the variant B11529, to discuss what we understand about this variant and if it should be classified as a variant of interest or a variant of concern. Based upon the information that we have, particularly from South Africa, they have advised WHO that this variant should be classified as a variant of concern. So today we are announcing B11529 as a variant of concern named Omicron. So Omicron, B11529, is named as a variant of concern because it has some concerning properties. This variant has a large number of mutations, and some of these mutations have some worrying characteristics. Right now, there are many studies that are underway. There's a lot of work that is ongoing in South Africa and in other countries to better characterize the variant itself in terms of transmissibility, in terms of severity, and any impact on our countermeasures like the use of diagnostics, therapeutics, or vaccines. So far, there's little information, but those studies are underway. So we need researchers to have the time to carry those out, and WHO will inform the public and our partners and our member states as soon as we have more information. Patients in other parts of the genome itself. Once a variant is classified as a variant of concern, it's really important that we have good SARS-CoV2 surveillance around the world, including better genomic sequencing, because we want to be able to detect this variant where it is circulating. It's also really important that studies are undertaken in the field to look at any clusters, and also the studies that are needed in the lab to look to see if there's any changes in severity, any changes in our impact on diagnostics, therapeutics, or vaccines. Divergent variant. It's different than any. The Technical Advisory Group for Virus Evolution will be meeting regularly about Omicron. It will take days to weeks for some of these studies to be undertaken. It's really important that these studies are done, and they're done comprehensively. As soon as we have more information, we will make that information public. But it's important to know that there's a lot that you can do to keep yourself and your loved ones safe. There's more than 30 mutations that we've seen in the spike protein. We understand that people are concerned. The good thing is that we have monitoring systems around the world to detect these variants very quickly. This variant was detected a few weeks ago, and already scientists are sharing research with us, information with us, so that we can take action. What's really important as an individual is to lower your exposure. The measures, these proven public health measures, have never been more important. Distancing, wearing of a mask, making sure that it's over your nose and mouth with clean hands, making sure you avoid crowded spaces, be in rooms where there's good ventilation, and when it's your turn, get vaccinated.